Health, Honorable Mutai Kagwe, who is here wearing two hats. The first hat is here as the Cabinet Secretary, Ministry of Health, but is also here as the Chairman of National Emergency Response Committee on COVID. CS, Ministry of ICT, Innovation and Youth Affairs, Honorable Joe Musheru, His Excellency, the Governor, Nyeri County, Mr. Kaiga Mutahi, Honorable Sabina Chege, who is the Chair of National Assembly Committee on Health, but also the Women Rep from Ranga County, Honorable Gichuki Mugambi, who is the area MP, the Chairman of Kenyatta National Hospital Board, Mr. George Ooko, CEO Kenyatta National Hospital, Dr. Evans Kamuri. I know there are many political leaders here, but I cannot mention all of them, but please, wherever you are, feel acknowledged. All invited guests, members of the Fourth Estate, ladies and gentlemen, once again, welcome to this event, which is a very, very important event, particularly when you consider the issues that the country is currently faced with, issues to do with matters of health. We are all aware about COVID, but I have to tell you that COVID is not the only health challenge that the country is actually dealing with. And therefore, this event becomes a very important intervention in as far as matters to do with health is concerned. The chair of the National Emergency Response Committee will be giving more details about such issues. And once he is done, members of the Fourth Estate are going to get an opportunity to ask questions. Like we always say, remember to mention your name and the media house that you represent, and keep the questions within the scope of today's briefing. Keep them short so that others can get the chance to also ask their questions. With those few remarks, I would wish now to invite the Governor, in whose county we are today, to make some remarks. Governor, please.
Thank you very much. Good morning, ladies and gentlemen. On behalf of the people of Nyeri, the government of the county government of Nyeri, I want to take this opportunity to welcome all of you to this place. More so, the Cabinet Secretary, Health, CS Kagwe, and also the Cabinet Secretary, ICT, Joe Muchero, Chairperson Sabina Chege of the National Assembly Health Committee, and all other guests who have come to be with us today. Before I say a word or two, kindly allow me to allow Mheshimiwa Mugambi Gichuki to welcome us to this place.
Thank you, His Excellency, Governor Nyeri, CS Health, Senator, I don't know whether it's Senator Honorable, Senator Honorable Mutahi Kagwe, CS ICT Joe Mushero, our Chair of Health Committee, National Assembly, Mama wetu wa County Nyeri, Madam Mukami, our all elected leaders, all our guests, ladies and gentlemen, hamjamboni. We want first to say thank you as Othaya people, because when you have wageni, when it's cold like this, unajua tunasema mgeni akija si mwenyeji pia na shiba. Yeah, so obviously COVID is reversing that. Haitaki wageni, but for sure we are happy to have all of you here during this period, especially when we know what you have come to do. So mine is just to say welcome and to say thank you to our CS Health, because we know you did take over the docket long ago, but already tunaona matunda. Tunaona matunda because you're here to give us the great support that we need as Othaya KNH Annex. I also want to say thank you to the CEO and the board. The chairman is here, Kenyatta National Hospital and his team for the support they continue to give to this facility. This facility, we know, it is our new kid on the block, and as I keep saying, Kenyatta is a very old facility which has existed for so many years, but it's the first time ambao imepata mtoto. Ni kama ile mama wa Biblia alikaa miaka mingi bila mtoto na akafanikiwa siku moja. So I want to appeal to the board and the people coming to work in this facility to really take care of this kid. Manake tumeomba mtoto miaka mingi na amepatikana. So we are happy and the area people are very happy. The region is very happy because this is a regional facility. And I just want to appeal to our CS. And I'm very lucky this time because he knows this hospital perhaps more than I do. Because he was there when it was conceptualized. And we know that you give us all the support. We still know hatuna facilities zingine. We still are waiting a mortuary. We still are waiting a kitchen. We still are waiting a radiology and many other facilities. But we know you are up to the task. We are up to this. You come from a very productive area, so bringing up a kid utakosa shakura. So, and we are happy that you are there. You'll be able to do it. I also want to thank all those who came to give us support from AMREF. I'm sure you'll meet them because of remembering us. So we just want to say karibuni sana, na hata mkiona iko baridi msikimbie. Hapa Udhaya tuko na mahali ya kutosha na chakula ya kutosha na partners wa kutosha, hata ingawa iko social distancing. Sijui itakuwa namna gani, lakini karibuni wote. Thank you very much.
Thank you. Asante sana. Asante sana Mheshimiwa Mugambi. Sasa tumekaribishwa mahali hapa. I want to recognize the county leadership that we have. We have the Deputy Governor, Caroline Karogo. We also have members of the County Assembly led by the Speaker and the Majority Leader who are here. We have the Speaker, the Majority Leader is here, and we have the Chairman of the Health Committee. We have the area MCA. We have a visiting MCA, Chinga, Ruben from Karema. The Assembly is well represented and the government is well represented. But I would want to say this before I invite the chairman, the chairperson of the Health Committee at the National Assembly, that Waziri, this was the first county to work very, very closely with national government, because we understood that devolution did not mean disintegration. When we took over government, we looked at this facility, we looked at the resources in our possession, and we realized that we were not able to properly run this facility, and we would not be able to offer the people of Nyeri the services they so required. And that is why we reached out to you, to the Ministry of Health, and to the President, and we are so grateful that he did accept, and the MOH accepted to take over the running of this hospital so that the people of this region are able to benefit. I have heard the sentiments of Mheshimiwa Mugambi. We agree a child must be allowed to grow. Step by step, precept by precept, we will make it there. But I want to appreciate the close working relationship between my county government and the national government, especially through the Ministry of Health, in the running of this facility, and also to state and say that the level 4 you see right across and this level 6 that are here are on the same grounds. We are working together, and there should be seamless transition between ourselves. Now that we are in the era of COVID-19, Waziri, I think as the governor of Nyeri, I am proud to say that Nyeri is doing a good job in the Ministry of Health, where you represent us. We appreciate that so far You have been in control of every step that we have taken. And today, as we sit here, you have also come to offer us even further solution towards beating COVID-19. As a county, we have done a number of things. We have set aside Mount Kenya, which is now running at 30 beds, and we are intending to run it to 50. But after our discussion with the President and yourselves, we are working towards creating 300 beds, where we think level 6 will also be part of ourselves and of that journey. We are looking at the possibility of broadening our outlook towards our hospitals, our teacher training colleges, so that we are able to beat COVID-19. All we want to ask for is closer networking between ourselves, my people at the Department of Health, and the people at the Ministry of Health and Kenyatta National Hospital, as we watch this hospital ultimately reach the dream of the people of Nyeri, which is to become a full-fledged national referral hospital that will have its own charter. I am sure, Waziri, in your time and your era, just like Esther was in a time in the Bible, you are there for an occasion like this. Having said that, we want to say we will work closely with you to ensure that we beat COVID-19. I will leave you to invite CS Moshero, but I'll take this opportunity to kindly ask my people to welcome Mheshimiwa Sabina Chege, who is the chairperson of the Health Committee at the National Assembly, and to remind her that any time she sees an item that is floating in the budget, let her take it down to Nyeri. Thank you.
Thank you very much, Governor Nyeri County, our CS Health, CS Motahi, CS ICT, CS Moshero, Deputy Governor Nyeri County, my colleagues at the National Assembly led by Honorable Mugambi and the women of Nyeri, Honorable Mukami, the Speaker of the Nyeri County and your colleagues at the county. Our development partners will come today to support this facility. Ladies and gentlemen, good afternoon. Mine is going to be very brief. First and foremost, to congratulate the Nyeri County leadership led by the Governor. As the Chair of the National Assembly Parliamentary Committee on Health, we have worked together and we have had a seamless working relationship in supporting this facility. CS, when you came in, we had already transitioned, taking over this facility to the national government. And one of the things that we saw was a bold step was for the Nyeri County to accept the national government to take this facility as a regional facility. And I also want to thank Kenyatta National Hospital, especially the CEO and the board. CS, we have done several medical camps just to try and tell the local community that this facility is open for them. And they have been doing a great job. And I can tell you from my county, just from the neighboring county, we have benefited a lot. And we want to really pass our appreciation to His Excellency the President for making this dream come true. CS, as we support this facility, and it's one of the facilities that is earmarked as a COVID center for this region. My committee recently, when we were doing the supplementary budget, we have already allocated 150 million in support of the facilities that are missing here. So I'm very sure you and your team will be able to do now the kitchen and the laundry. And we also expect that also county government will help us to complete so that we also do the morgue. And so it is going to be a fully operational facility. For AMREF, Rockefeller and other development partners, thank you very much. We don't take this for granted and continue supporting us. My county is just in the neighborhood, so whatever has remained, make sure you pass through the county of Murang'a. So I just want to take this opportunity, CS, to congratulate you and your team also for the great work you have done in the fight against COVID. I have only one request to you, because when things happen in the ground, a lot of people talk to us, that let's help the community stop the stigmatization of COVID, and especially for the people who have gone through the treatment and are going back home. And also, CS, to have a special communication to the medical facilities. When somebody tests COVID and passes on, the protocols on burial need to be very clear. We have had several families getting traumatized one of our colleagues was actually forced to bury the mother at night at around 7:30. And so the protocols need to be clear so that Kenyans cannot have the stigma. And so those communications to our health facilities and even to the public, so that they know once a person passes on, the protocols that need to be followed and there's no harassment, so that we give respect to the people and especially their culture and religion. So I thank you. So far, it has been good. We are looking forward to work together with the county governments on the agenda of the UHC. We had a meeting on Friday CS. Several governors sent their memoranda, and especially the governor of Nyeri also. And we are in agreement that we'll work closely with the county government to make sure that we help His Excellency the President deliver the UHC. And this is the time that we are rolling out to all the 47 counties. I want to thank you. Thank you very much. Asante.
Thank you, Sabina. Allow me now to, I forgot, Mama County was standing right next to us here. Just say, pass a word, and then we can get back to Oguna.
Thank you so much, CS. We want to thank you so much. We really appreciate that we have this facility here in Othaya. So watu wa Othaya tumefurahi sana. Yeah, we are lucky, and we are going to support you. We are going to give you full support. We are behind you, and we are going to work together. Thank you so much.
Thank you very much. May I also recognize Mheshimiwa Kanini Kega. He is my MP from Kiani. Unaona kwetu hakuna baridi. That is why you are standing like this. Now he is shocked to find maneno ni namna hii hapa. Bwana Oguna, now take over the program. Thank you very much.
Thank you very much, Your Excellency, the Governor of Nyeri County, who today really is our host. And at this point now, I would like to invite the Cabinet Secretary, and who is also the Chairman of the National Response Committee on Coronavirus, to be able to carry on from here.
Hamjambo? Adora muriega. Muri okuo. Ona kwa ya heho. Tutigutigira. Asanteni. Before I make a few remarks, I would like first to invite some of the people who are here today. There are some people mnaona kwa magazeti, mnaona kwa video na mambo kama hayo. Kwa hivyo nataka muone hapa. Idetigu idetigu. Kwanza Mheshimiwa Kanini, kwanza salimia watu hapa kidogo. Where is that thing? Ukahalia, kama hao. Salimia watu hapo. Na ndio ni shabesh. Ameenda. Oh, okay.
Thank you so much, Waziri. We really appreciate, because this is something that we have been waiting for. Othaya Hospital, of course, under Kenyatta, and it is a day that we have been waiting for. And we know that this is not a hospital for Othaya only, but for the rest of the region. Actually, Nyeri, all the region. So we really appreciate. So Waziri, I don't know what to say much, because leo ni siku yako. Tunataka tu kusema karibu sana hapa. Hata kama hapa kuna baridi, unaona vile pia ni maneno iko.
Naona.
Lakini usisahau mimi ni kijana tu, so.
Okay. Alafu, I would like to invite my colleague in the cabinet, Joe Mushero, to also say something.
Thank you very much. Mazima. Mine is going to be very brief. Waziri, as you know, we've been working together. You've heard he's our chairman in the National Emergency Response Committee. So let me recognize all the leaders that are here, the governor, the MPs, the women reps. Tunafanya kazi pamoja. In our budget, we now have money to connect all the hospitals with fiber. We have already completed the data center at Kwanza, which is going to allow us to put all the machines you've been requesting, Waziri, so that the hospitals can not only interact and work together, but each patient can get their own electronic medical record, so that then we are able to manage this pandemic in a way that works, and even for future, as a country, we're going to be a lot more prepared as far as health is concerned. let me say also that one of the tasks I have is also to communicate and let people know all the things that you keep saying. And so I want to thank you, because I think you've become the latest star in the country. Mumesikia Gary.
Get it.
So I want to thank the social media people, because for the first time the social media people have helped us send really the right message. So now we have a star who is saying, Garrett, I don't know if today you have a new number you're going to reveal for us. But I think every Kenyan, even the young children, they all know that they can get it.
You can get it.
Sorry, tunajua hiyo. Waziri, endelea, asante sana.
Asante.
Thank you.
And he gets it. I also want to introduce a few people. Ambayo pia I would like to introduce the chairman, George Oko. Where is George? Yeah. Huyu mzee anaitwa George Oko. He is the chairman wa Kenyatta National Hospital. Kwa hivyo ndio chairman wa hii hospitali iko hapa. You know, George, you want to say something, George? Yeah.
Asante sana CS for health CS Information, ICT, Joe Mucheru, Governor, all the leaders, asanteni. Just to give everyone an assurance, sisi kama board, we are going to make sure kwamba Othaya Hospital Kenyatta branch grows. We will give you that assurance. We are going to work very hard. I'm here with my colleague, Stanley Maina from the board as well. Imam Konoju is there. Together with management and all the staff who work here, we are really going to be dedicated to this task.
And Kamuri.
Dr. Kamuri, CEO, is here. The director of the hospital, Dr. Murori, this is the director of the hospital. That's our CEO, Dr. Kamuri. This team will ensure that we deliver and we work very hard following the guidelines from the ministry. Asante.
Thank you very much. Asante sana. Thank you very much indeed. Now I would like to invite Dr. Amos. Asimame kwa wajua, I can't speak when he is not here.
Thank you.
No, you stand there because you have a question to answer. Already Sabina has raised one question about the whatever, but I'll give you a chance when the questions start.
Thank you.
Wananchi wapendwa, fellow leaders, hamjamboni. I'm delighted and indeed pleased to be part of you here in Nyeri. Nyeri is one of the counties that I'm privileged to visit during this period of coronavirus pandemic. Let me start by appreciating and thanking the Governor, Mutahi Kahiga, and the people of Nyeri County for the role you continue to play to contain the spread of coronavirus disease in the county, cutting the cycle of transmission and reducing conditions that aid the virus to spread is a fight that no level of government can win on its own. Without the involvement of the people, we cannot win this war. Success in any effort by the government largely depends on the level of involvement of the people. I therefore want to thank you for working together with the county government in the containment measures. The collaboration is responsible for the very low number of COVID-19 cases at only 9 from a pool of 459 samples so far tested here in Nyeri. 3 of the positive cases are healthcare workers who contracted the virus during the normal course of duty. This is a great sacrifice to our people, and I want to recognize them for their devotion and commitment to duty and wish them well and quick recovery. Healthcare workers are our heroes in this fight, and I shall spare no effort to ensure that they are adequately protected. The Ministry of Health will continue to work with the county government of Nyeri by offering support to upgrade the county human resource and equipment capacity. To this end, the ministry has supervised the training of healthcare workers in each county and sensitizing at least 1,281 other cadres of healthcare workers. For Nyeri County, we will strive to provide more, and my desire is to ensure that our people can access the best healthcare services across the entire county and country. Fellow Kenyans, COVID-19 is not the only health issue that the government is concerned about. As you are aware, the national government's vision on health is healthcare for all Kenyans. This vision was derived from the realization that Kenyans must be healthy to positively engage in economic growth and development of our country. Therefore, COVID-19 is not the only disease burden, but there are others as well. I want to discuss some of them here in Nyeri today, particularly the non-communicable ones such as high blood pressure, diabetes, and cancer. These conditions are a major public health concern with significant social and economic implications in terms of healthcare needs, lost productivity, and premature death. They hamper our nation from achieving its social, economic, and development targets. While infectious ones remain a significant cause of disease and death in our country, the incidence and mortality from non-communicable diseases is rising rapidly, resulting in a double burden of disease, and further straining our healthcare systems. The non-communicable diseases contribute 1 in every 3 deaths and account for half of all hospital admissions in our country. Deaths due to NCDs are projected to rise to 55% by the year 2030, unless appropriate interventions for sustained attention on prevention and care are put in place. NCDs are known to have the potential to drive individuals and households into poverty, owing to the catastrophic costs of care and their nature. It is further estimated that they can decrease households' income by nearly 30%. I'm concerned that close to 24% of our population is living with high blood pressure, while 5% have high blood glucose. It is equally unacceptable that over 47,000 new cases of cancer are diagnosed and 32,000 patients die of cancer each year. My ministry is aware that the magnitude of NCD's situation in this country and the prioritize prevention and control of non-communicable diseases in Kenya in our health policy 2014-2030. Among the areas of focus of this policy is strategic partnership with county governments and other stakeholders as we implement best buys as enshrined in our NCD strategic plan of 2015 to 2020. As you also may be aware, Nyeri is one of the high burden counties for NCDs, with close to half of deaths in the county caused by non-communicable diseases and about 700 new cancer cases annually. Nyeri was selected as one of the UHC pilot counties due to its high NCD burden. We laud the county government for putting in place measures to halt and reverse its rising burden of NCDs. These include initiating vibrant NCD clinics at primary care level and integration of NCDs in community health services. This is strengthened by clinics in the county, referral, and sub-county hospitals with an established cancer treatment center and the adoption of the Ministry of Health standardized data management tools for NCDs. And I want to say that one of the reasons why it was so important for us to come here with Cabinet Secretary Joe Mushero is because of how we want to predicate the healthcare systems and use ICT as a way of modernizing ourselves and fighting disease, not only here in Nyeri County, but across the country. And I'm glad to note that the county also conducted a successful breast cancer screening campaign using mammography during last year's World Breast Cancer Month in October. My ministry will continue to support the county to further accelerate these efforts. Ladies and gentlemen, these NCDs are often silent, showing no symptoms for many years, even when the disease is advancing. The vital warnings will often go unnoticed, and unless we create time to take simple, cost-effective, and rapid screening tests. In most cases, by the time one develops symptoms, complications are usually advanced, and the risk of emergencies like heart attack or stroke is greatly increased. Getting this warning signal early is by far the best option. The actions that can be taken when detected early are way cheaper and less risky for patients than interventions in later stages. As I have stated severally, persons living with NCDs are more at risk of becoming severely ill with coronavirus disease than those without. To protect persons living with NCDs from the effects of COVID-19, my ministry has been running an awareness campaign and issued guidelines to health on the management of patients with COVID-19 and NCDs, as well as guidelines for continuity of NCD and mental health services in our health facilities. I want to urge all our people with NCDs to follow medical advice and regime of medication while at the same time observing COVID-19 containment measures of hand washing, social and physical distancing, and I can see a lot of lawbreakers here, and proper wearing of face masks in public places, among other measures. As I conclude, let me briefly give you our COVID-19 statistics today. We have 137 people who tested positive from a sample of 3,167. The overall disease burden in the country now stands at 3,594 from 115,336 number of samples tested so far. Nyeri still remains with 9 persons infected, and I want to urge the people of Nyeri to continue working together with the county government so that this figure does not rise. And this applies to residents in other counties as well. Finally, allow me to reiterate our commitment to supporting not just the Nyeri County government, but the entire country in the control of non-communicable diseases, particularly in this period of COVID-19 pandemic. Diseases, particularly in this period, are rising as the government continues to meet its constitutional obligation of providing preventive and curative health services of the highest possible standards. I call on all of us to assume responsibility of our own health and wellness, and in embracing the preventive measures we have spoken about so much. I want to thank you, the people of Nyeri, na wananchi kwa jumla, na viongozi ambao wako hapa, na tuseme ya kwamba wakati umefika wa sisi wenyewe, kila mtu binafsi, kuchukua usukani wa kujikinga mwenyewe, because the government is not going to prevent COVID-19. It is the individuals who are going to make sure that we do not get this disease. We know that globally, we have seen what has happened globally. Umejionea nyinyi wenyewe, hata Amerika, ambayo ni nchi ambayo ina uwezo, imeshindwa na hii virusi. Kwa hivyo jameni, tafadhalini, kila mtu ajue wewe mwenyewe ndio unajishunga na unashunga yule ambao mnakaa na yeye, and I have said, assume the person next to you is COVID-19 positive. Wewe muangalie. Huyo mtu ukimwangalia hivyo, the best thing, the way to protect yourself is to assume the person sitting next to you or standing next to you. Kwanza ukimwona hana mask, go away. You know? Just move away from that person. And hygiene is what is going to assist us. Ukienda hapa Udhaya, uende soko, if you want to buy a cabbage, ukitaka kununua carrot ama cabbage ama boga ama gwashe, na uone yule mama ambayo anakuuzia hana mask, na hakuna mtu alisema ati unawe mkono, hakuna sanitizer, na wewe unachukua hiyo mboga, na mboga hiyo ujui ni nani alikuwa ameshika hapo mbeleni. Mtu anaenda hana mask, hana chochote, anachukua mboga, anaiangalia, weighs it in his hand. I don't know why we weigh. Anapima kilo ya mboga yeye mwenyewe bila ana upimi. I don't know how you do it, but anyway anapima alafu anaweka chini, na ile mkono yake no sanitizer, no washing the hands, nothing. Alafu wewe mwenyewe unafuata sasa, unachukua hiyo mboga, unaiangalia vizuri, na wewe pia unapima ni ya kilo ngapi. Saa hiyo unapima, yule ambayo alikuwa hapo mbele yako alikuwa ameigusa, na yeye alikuwa na virusi, na wewe unachukua, na wewe pia unafanya hivyo hivyo. Alafu governor anafuata pia. Sasa sasa mumeona hiyo hadithi. Can you see what I'm saying? So let's make sure ori ha thoko-ini akoro we niwe ndagiria ndumbuka ha thoko-ini, we ugakoragwo na sanitizer, na andu makiingira thoko magethamba moko, nigetha wanyita mboga ĩyo kana wanyita karati ĩyo kana itunda kana maembe, wanyita ti ũhoro wa kũnyita wĩna mũrimũ ũgacoka ũkaigĩrĩra hau, na niĩ ngoka ngoya iembe rĩrĩa ngambĩrĩria kũrĩa, alafu sisi zote tunaumbukizwa. Tuli hamwe? Tuko pamoja jameni? Yeah, so let's just protect ourselves that way. I also want to take this opportunity to thank the partners who have worked with us, the stakeholders who have continued to support our effort. The president has asked us to work together. Na ni amugeithia, mwageithio ni president wa republic ino yitu. President Uhuru Kenyatta ni mwageitheka. Aurathi muturi haha amugeithia na njira ndimwire ni aguka thibitari ino. We ni wogoka kuhingura thibitari ino. So I want to thank the partners who will continue to work with us. I want to thank AMREF, whose CEO is here, regional CEO is here, and I also want to thank the Rockefeller Foundation, and the CEO is here as well. Kwanza introduce us. Come.
Thank you very much, Honorable Cabinet Secretary, all elected government leaders. Thank you for this opportunity. Just to remind everyone, 2 months ago we signed an MOU with the Ministry of Health and AMREF to support the COVID-19 response, and we have been working together. Today is just a continuation of that same MOU which we signed for 100 million Kenyan shillings to support the government in its COVID-19 response. And what we have discussed today is that we will not just focus on COVID-19, we will continue this partnership with the Ministry of Health to help with a number of other issues that continue to emerge. I thank you very much for this opportunity to introduce the Rockefeller Foundation and to introduce myself. And I just want to confirm, Waziri, that at the Rockefeller Foundation, we get it.
Before you go, I think we discussed with you something about the provision of an oxygen plant here in Odaya, and I know that we are going to engage each other. No, I just wanted these people to know that that discussion is ongoing. I don't know whether you want to say anything about it.
Yes, thank you. Thank you for that. That is indeed correct, Waziri. That discussion is ongoing. We have been made to understand that there is a lack of oxygen generation in the region, and that this facility is the most appropriate place to place that generation capacity. And we are continuing to have those discussions and we support it.
Thank you. Thank you very much. Now, I also want to invite Githinji. He's here, so that he can tell us what the Rockefeller Foundation has brought to us through AMREF.
Waziri, asante sana. Ndaiwa tumakiuka maudhukitio tambo kama kaigwa we murito ni rauta hilo yo. You get it as well. Mimi natoka hapa Udhaya. I am a resident of Udhaya. I run AMREF, but I work very closely with the ministry, the county government, and the national government. And Leo, we have brought support from Rockefeller Foundation. William, thank you very, very much. We partner very closely with many partners, and today we have brought 35 beds with mattresses to support. Na moja iko hapo mtaiona, zingine tayari zimetandikwa huko, to support the center here that is going to be supported under Kenyatta. We are also bringing in 3 patient monitors, which are here, 4,000 full kits of PPE, 4,000. So health workers here are supported. I have Waziri asking them, do you feel protected? And yes, they feel protected. We brought 4,000 sets of full PPEs and 1,000 cartons of sanitizers, which are here also. So I must thank our partners. Thank you, Waziri. Thank you, the Ministry of Health, and also the county government and the health committee we work very closely with. But I just want to leave with one message, because we are coming to work with you also, that as Waziri said, as we move forward, the next phase, Timba Nisisi, it is us. And I think the Ministry of Health has already said they're releasing a protocol for home-based care. In that phase, the individual, the household, and the community are extremely critical. I want to recognize the value and the work done by community health volunteers and community health workers, because they are going to be a key asset in home-based care. So please respect them. Let us support them, Governor. And I want to say that AMREF is also coming to work with you, and a grant from the European Union, again working closely with the Ministry of Health, to make sure that we provide medical supplies to the hospitals here, training health workers, and also community engagement. The oxygen discussion, I can confirm, we've agreed we are going to start off with providing a bulk oxygen supply here. We have agreed that with the CEO of Kenyatta and the director here. That we are going to do immediately, so that the 7 beds of ICU can be operational. And then we are then going to work with Rockefeller for the bigger investment for the region. But the oxygen here, that will be an immediate investment in the next 1 or 2 months that we'll be working on. Thank you very much.
Asante sana. Asante sana. So I would like to ask Dr. Amof to just come and explain the protocol that Honorable Sabina Chege spoke about, and that's the protocol for burial. When a person is COVID-19, when the cause of death is COVID-19.
Thank you, Waziri Musheru, Excellency Governor, Excellency Deputy Governor, Mama Sabina Chege, all elected leaders. The World Health Organization developed guidelines on how to take care of bodies of COVID disease persons. In turn, we took these guidelines and customized them to be able to fit our cultural practices. So once the body is prepared and is double packed in a body bag, the body is relatively safe. If you look at the transmission of COVID-19, and like other infections, there's very little likelihood that if the body is treated well, you stand a chance of getting infected, compared to conditions like viral hemorrhagic fevers, like Ebola or Marburg. So as long as the body has been taken care of by our public health officers, the body is safe. Therefore, what we need to put in place is to be cognizant of our cultural practices. If the culture dictates that we don't bury at night, please just hold on for another 12 hours so that we're able to bury the following day. Waziri, we are going to work again to send an alert to the counties to remind them of this protocol, so that we have a dignified burial of those who succumb to COVID disease. And our offices are open. I can give you my phone number, 0721 518 918. If there's anything that you feel requires my attention, that the healthcare workers at a particular place are not adhering to the guidelines as provided, please reach out to me. My phone is on 24/7. Thank you.
Asante sana.
Gentlemen, it's your time to ask questions now. Please remember to mention your name and the media house that you represent and keep them short. Who wish to go first? Yes. Yes, you.
Yes, my name is Ibrahim Karanja from KTN, and my question is actually on donations. Thank you so much. My name is Ibrahim Karanja from KTN News, and I have a question for you and a question for Governor Kahiga. Now, my question for you is on donations that the Ministry of Health announced to have received on the 12th of May from China. Now, on the same day, 12th of May, which had the Ministry of Foreign Affairs, I arrived into the DCI to investigate a possible theft of the same COVID-19 donations. Now, did the Ministry of Health receive these donations from the Ministry of Foreign Affairs, and are you aware of the attempted thefts at the airport? My second question to Governor Kahiga would be, Governor, there are complaints actually from this particular facility of doctors who work here but live, say, or reside in Nairobi. That's actually from the KMPDU, that's at some point the county government was frustrating their efforts of service delivery at this particular facility because they're coming from a hotspot area. Is that true, and what's the position of the county? Thank you.
Another one? Yes.
Good afternoon, Waziri. My name is Melita Oletenges from NTV. My question would be, there's still a major concern concerning the PPEs across the country, and of course here in Nyeri. And I'd like to draw this to your attention that here in Nyeri, the doctors that are currently in isolation are actually contacted the disease through their contact with the outpatients. Perhaps, what is the ministry doing to address this issue of PPEs across the country and also here in Nyeri? My second question is, what is your position concerning leaders flouting the rules, the COVID-19 rules, particularly social distancing, wearing of masks? We've seen this in Western region in recent days, and also not so long ago here in Nyeri. What is your position, Waziri, concerning this?
Yes, maybe the last. Another one?
Waziri, my name is Purity Wahu, K24 and NTV. I have a single question. There are 8 roadblocks that surround Limuru, hence make the area inaccessible, which means just like Nairobi, Mandera, and Mombasa, there is a cessation of movement in and out of Limuru. Why is it so?
Maybe the final.
Final question.
Maybe the last one.
Okay, now you mentioned that Nyeri, of course, Central Region has a high rate of non-communicable diseases. What is the ministry's projection? Now that we have 9 cases in Nyeri County, what if we have more cases? We have 9 cases, 1 death. So what is the mortality rate in Central Kenya or in this particular county? My second question would also be related to that, especially doctors. Doctors in Central Kenya have said that they are at a high risk of contracting the virus due to the fact that most of the patients, even the COVID-19 cases here in Nyeri County, do not show any symptoms, so they do not know who they are handling. So what is the county or what is the ministry doing to ensure that they are safe, the doctors are safe? And lastly, they're also saying from KMPDU that they have not received their rest allowance. Maybe as a ministry, what is the progress?
Asante sana. Maybe Governor, you can go first.
Thank you. Thank you. Yes, all workers working in KNH Odaya are under KNH and not under the CGN. That is number one. But number two, I am guilty of making this statement that since KNH Nairobi and KNH Odaya are one and the same, I say, can we allow the doctors in KNH to work in KNH Nairobi And when I was saying that, at that time and season, we didn't have any cases in Nyeri. And therefore I was suggesting that if those doctors remained there where we had those cases, they wouldn't bring them here. That's all I meant. Thank you.
Asante sana. Now, let me just start with the last ones. Regarding Munene, you are asking about the doctors, the risk, and I think I want to combine that with also Merita's question regarding PPEs. First and foremost, we have brought here to Nyeri today a sizable quantity of PPEs. And I would like to appeal to the governor that we also want to share what we have here with Laikipia and possibly also Nyahururu, Nyandarua counties. Now, we have no shortage of PPEs in Kenya. Let me start there. Because we are also lucky that we have now started local production of PPEs. And we have said, in fact, that we are not going to import any more PPEs because local production is sufficient and we can cover ourselves and possibly also have sufficient for export from Kenya because of the capacity that we have built over the last very short period of about 60 or so days. So we have sufficient PPEs. And my appeal to the health workers is that they make sure that they are suited and work within the guidelines and within the training that has been provided by the Ministry of Health. So in terms of protection, I have repeatedly said, and we have as a ministry repeatedly said, that the most important people in this fight against COVID-19 is the health worker, is the health working team. Because obviously they are the ones who treat us. If our doctors were to start falling sick, then who were our soldiers? I mean, who would treat us? So it's very important for us, you know, that the doctors remain safe and the nurses and the clinical officers and people in laboratories remain safe. And they are doing a fantastic job. We are lucky that as opposed to other nations, as opposed, say, to Spain, where they lost a lot of their health workers, we have not done that. And we pray that this continues to be the case. So we will protect our health workers to the best of our ability, including even the risk allowances that you are talking about, and other packages that we are working on for them. We will continue to respect them and respect their welfare, because it is important that we do that. Purity, you are asking about roadblocks. I don't know how you know there are so many roadblocks, because unless you are breaking curfew, and not following the guidelines regarding cessation of movement, because you're not supposed to have left in the first place. So if you keep to the guidelines, then you are very unlikely to get affected by any roadblocks. You know, and by the way, there should even be more than those, you know, to enforce the situation and make sure that Nairobi people stay in Nairobi. I am here only as an essential. Community health worker number one. I am just here as an essential services provider. Otherwise, I should not be here either. And you are also here as an essential service provider. So, other than that, I want also to say that there are no two laws in Kenya. The laws apply to everybody equally. And I want to state here that the Ministry of Health and indeed the government does not support this issue of people feeling free now to start social gatherings. You know, may they be political, may they be funerals, may they be weddings. We are saying that, and we are asking our enforcement agencies, and particularly the chiefs and sub-chiefs, through the Ministry of Interior, we have requested that we follow the regulations strictly. And people are beginning to feel as if we are post-COVID-19. No, we are not there yet. So we must observe the rules. As leaders, we are the ones who should be setting the example of how to do that. Yet, there is leadership that is setting an example of how to break the law. You know, so I want to urge leadership, whether it is spiritual leadership, political leadership, you know, I want to urge that we set an example as leaders to observe what the guidelines that the Ministry of Health has provided. And we do not condone the breaking of the law by anybody, anywhere. Let's just state that way. On the issue of the incidents at the airport, yes, indeed, we are aware that there was something like that there was the Jack Ma donations and other donations that have come, you know, but it's an incident. We know that there was something like that. There is an ongoing investigation, and therefore I can't talk about it any more than that. Let the enforcement agencies and the detectives determine who was trying to do that and who does it. And as for PPEs, it is true that we also experienced an incident of persons wanting to steal PPEs, I assume, to go and sell them, you know, to private hospitals and so on and so forth. So again, these are thieves, and I can't speak for them because I would assume that the law is going to take its course and we are going to have them arrested. You know, this is what happens. When you steal, you get arrested, you get jailed. And this is what is going to happen. So I would only urge that when we provide PPEs, they are there to protect our health care workers. And therefore, please respect, they cost a lot of money. PPEs are not cheap, they cost a lot of money. And therefore, when we provide them and when we give them, we expect them to be used for the purpose for which we have given them. That's it. So thank you very much indeed. Asanteni sana.
We can present the bet.
Yep. Let's do the bet. Let's do the presentation. Yeah.
This is NTV.
Do your gums hurt?
Yeah.
Does your toothpaste contain sage, eucalyptus, myrrh, chamomile?
All that in one toothpaste?
Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums.
Ah, Colgate Herbal.
Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
Mining, a key driver of employment opportunities in the country, a major source of export revenue for Kenya, and with budding prospects in the oil sector, a vital pillar of the country's economic diversification. This Tuesday, Business Redefined digs into what lies ahead for the mining sector in the coming financial year.
Ongezea tu nyama ushike.
Sasa watu wataona aje unanishika hivyo mbele ya watu?
Hata kama ni nini tunaenda.
I can say now, if you go to the Mara, you'll have an explosive game drive. The best scenery ever.
Sisi ni watu wanategemea wasungu. Tunashona.
With the coronavirus, tourism disappeared through the window. All the lodges, camps, tourist facilities, safari services just collapsed.
Kwa siku nilikuwa tengeneza hata kama 5,000 hivi. Penye hatuna wasungu, tunategemea msaada.
Leo tuko manyumbani wote kwa sababu ya coronavirus.
There has never been a time like this in the history of the Masai Mara Game Reserve.
All right, be good. If you can't be good,
Don't get caught.
Love you guys.
Love you too. Love you too.
Okay, who can give me the derivative of X?
what's going on?
Did you guys see that? Oh my god.
At 1:07 a.m., the Odyssey satellite received images of an object moving past Mars.
It's right over us. I want to see.
I didn't know it then, but that was the last normal day of my life.
We have reason to believe there's an imminent threat to this location.
All right, stay with your sister.
The waves have begun.
This Sunday on Churchill Show,
I got into singing. Just immediately I got into theater.
we feature a story of passion, perseverance, and what it takes to build a brand.
What has the bed got to do with it? Because I'm here thinking, hiyo kitanda inaingilia wapi?
Madam, you can even find her dancing to Chronics. Uko tu hapo tu kwa Chronics. Sasa ngano wacha ngo. Huyu mtu anasema
This is the story of Jackie Nyaminde, Will Brother.
Kondoro mwalo, kondoro kondoro.
Tunakanya.
Saa hizi kupimwa HIV ni haraka na ni bure. Unaweza pimwa kwa clinic na bado unaweza jipimia kwa nyumba yako wewe mwenyewe na self test kit 500 peke yake. Uko na HIV si eti ni mwisho.
Wewe uko nayo?
Mimi nilishapima.
Afya bora, maisha.
Do your gums hurt?
Yeah.
Does your toothpaste contain sage, eucalyptus, myrrh, chamomile?
All that in one toothpaste?
Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums.
Ah, Colgate Herbal.
Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
Kumbuka, unapojilinda unawalinda wengine pia. Tuko pamoja kwa hili.
I am in Accra, Ghana's most bustling city. I'm on a quest to find out how young people are pulling together their resources to start successful business.
Music is part and parcel of the African society. In fact, it's who we are. Music worldwide is a multi-billion-dollar industry. Every few seconds, someone is seen on their phone looking at what is a notification or something else, which makes sense for business nowadays to make sure that they have a very heavy online presence. What happens to the older businesses, what we term as brick and mortar?
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.